It's a pleasure to have the opportunity to introduce our distinguished guest speaker, Lindsey Justynski. Lindsey works as the Breast Health Navigator at Peterborough Regional Health Centre in Ontario, Canada. She has occupied this role since 2009 and was instrumental in developing the role based on the needs of the department and community. Lindsey also serves as a coordinator for the hospital's Multidisciplinary Cancer Conferences. She completed her Bachelor of Science from the University of Toronto with a certificate in nuclear medicine. She worked as a clinically as technologist for a few years before transitioning to the Patient's Navigator role. She became certified as Patient Navigator with the National Consortium of Breast Centers in 2015. Lindsey also collaborated with Fleming College to develop the Patient Navigator Fundamentals course and went on to teach for those interested pursuing a career in patient navigation. Today, Lindsey will talk about the role of breast cancer navigator in multidisciplinary care. Welcome, Lindsey Justynski.
Thank you for that introduction. It is my honor today to be here speaking about the role of breast navigator in multidisciplinary care. I will preface that this presentation is based mostly on my experience in Canada and the United States. However, I do feel that this role is universal and can be adapted to the needs of the community it serves. The diagnosis and treatment of breast disease involves multiple disciplines, including but not limited to primary care, radiology, surgery, oncology, pathology, genetics, etc. For patients and their families, this diverse healthcare team and the information they each provide can be overwhelming and difficult to navigate. A breast navigator can help guide patients on their journey and try to make it as smooth as possible. So what is patient navigation? As Dr. Harold P. Freeman, the pioneer of patient navigation, defines it, it is a process by which an individual, a patient navigator, guides patients and their families through and around barriers. Barriers are things like access to transportation, financial barriers like the costs of services, system barriers like access to different types of tests and treatment, communication barriers like language, as well as emotional barriers like fears and anxiety. The navigator is there to guide them through these barriers in the complex healthcare system to ensure timely movement of the patient across the entire healthcare continuum, from prevention, detection, diagnosis, treatment, and supportive to end-of-life care. This diagram from Dr. Harold P. Freeman shows that the initial model in his pilot program focused on patient navigation during the screening of breast cancer through to the diagnosis and treatment. However, further research and experience has shown that patient navigation is also beneficial in the outreach and prevention stages, as well as the phases of survivorship through to end-of-life care and palliative treatment. The key for creating a patient navigation program, though, is to define an endpoint. It's not feasible to navigate patients indefinitely, so defining that set endpoint is important. For myself, at my local regional hospital's breast assessment center, my primary focus is on the same as Dr. Freeman's original model, the screening through to diagnosis and treatment. However, I do on occasion spend time with outreach and prevention by partnering with community organizations to promote breast health awareness in the community, as well as through the relationships that are created during the diagnostic and treatment phases. Sometimes I end up supporting patients through that survivorship phase as well. The key, though, is to define that endpoint. So how can a breast navigator help patients and their families? These are some of the things that I come across on a daily basis. I think the important piece is that a navigator has that dedicated time to do these things. Not to say that other providers can't as well, but they have that more dedicated time because they're not providing clinical care. You're there to answer questions and help patients better prepare for appointments. You're there to help them learn about their diagnosis and treatment. We all know that when a patient hears the word cancer, there's that shock and not much is heard sometimes after that. So having someone that they can reach out to review that information and help clarify things is really valuable. A navigator is able to help patients find resources and community supports in the community that they live in. Things like peer support programs, maybe mastectomy supply stores, or just even finding reliable information on the internet. In general, just there to guide them through the healthcare system. The navigator can help them feel more in control of their care and help them speak with doctors and staff, giving them that confidence to ask certain questions or clarify certain information, and also there to streamline and schedule appointments, which helps to coordinate their care. So a navigator can help patients, but how can it benefit others in the healthcare system? The navigator is in a unique position in that they're able to see the patient's journey throughout the entire healthcare continuum, not just one episode of care. So they're able to see inefficiencies and opportunities for improvement and barriers in the system. They're able to assess patient needs and help them determine who can best assist them, or if that's a good question to ask the provider. So then they get more out of those consultations and visits. And the navigator is able to help empower patients to advocate for their own care, which in turn creates a more compliant and satisfied patient when completing their treatment. In my role as navigator, part of my job is to attend and help to coordinate multidisciplinary cancer conferences. And I just wanted to highlight the value of these in providing quality care. I think they're in place at many large centers, but just to review, multidisciplinary meetings allow for all players on the patient's healthcare team to discuss the proposed plan in one setting. At our hospital, this involves pathology, radiology, surgery, and oncology. For patients, it provides them more confidence in the proposed plan. It's like they're getting the opinion of multiple doctors, but only having to see one. These regular meetings allow for quality issues to be discussed that impact care, and it's an opportunity for discussion about how the program can be enhanced. It also lets providers see how others deliver care in a non-judgmental environment. When our rounds originally started, they were in person. However, with the pandemic, they did move virtually. And although I think it was nice to have everyone in one room, I feel that they've been much more attended with that option to have remote access. So I think this is an important piece if starting up multidisciplinary cancer conferences, to have the remote option. Clinicians can come right after a clinic or in between surgery, or even if they're not in the hospital at the time, they can tune in remotely. So ours have been very much well attended since having that remote option. So what makes a good patient navigator? I thought I would just touch on this for those that maybe are currently navigating and want to improve their service, or if you're starting up a patient navigator program. Of course, it would be great to have someone who's had experience in the field of the patient population you're navigating. So for example, maybe an oncology nurse or an imaging background. However, these things can be learned, but experience in that field is definitely an asset. Having some sort of medical education is very valuable. However, there are lay navigators out there, which is more of a role for people who have maybe personally experienced the disease, whether that be with themselves or caring for a loved one. They still have that knowledge base, but their clinical scope is more limited. However, they can still have a role in the navigation role. It's just a bit different than more of a healthcare navigator. But what I really wanted to highlight was the personality traits and skills that provide success in the navigator role. You need to be compassionate and have empathy, a good listener. I spend most of my day listening to patients, and being able to actively listen and really pull out what the major concern is very important. And in a very neutral manner. You will be asked about your opinion daily, but you need to remain very neutral in your opinions as a navigator. Able to troubleshoot and prioritize. You're always problem solving for the patient, whatever that concern or issue is be. So being able to reach into your toolbox and find different ways to help them out, or send them to someone else that can. The ability to stay organized. You'll be tracking multiple patients over a set time. So being able to track those patients throughout that system, some sort of way to do that. And most importantly, having the ability to communicate and those interpersonal skills, not only just being able to communicate with more of a lay language with patients and their families, but then also to be able to speak with other professionals and create those relationships so that you can rely on them when you need to advocate for your patient. And this slide here is really just for examples and reference only. I don't have any affiliation with these institutions, but when I started out my role, there wasn't a lot in terms of certification or training for the patient navigator role, and that has really changed in the last 10 years. So the National Consortium of Breast Centers is in the United States, and that is where I became certified. So you can write an exam to become certified as a navigator in breast imaging. The other two are just training facilities in the United States and Canada. The good thing is both of them offer programming that's online, so this could be accessed anywhere in the world, but there is many more out there that have started these training programs because of the need for this role and those interested in starting up a program. So in conclusion, the diagnosis and treatment of breast disease involves multiple disciplines, making it a complex process. A breast navigator can oversee a patient's journey to ensure timely, coordinated, appropriate, and quality care are provided. A breast navigator can communicate amongst disciplines to help advocate for the patient, but also encourage patients to advocate for themselves. Thank you.